Hi everyone, and welcome to this webinar on the pregnancy journey and having a baby during the COVID-19 pandemic. I'm Diana Sheng, and I'm joined by a few of my colleagues today from the Family Way Obstetrical Group, and we're a group of family physicians who specialize in low-risk pregnancy and birth. We are located downtown Toronto, and we see our pregnant patients at Women's College Hospital and deliver at Mount Sinai Hospital. So right now, I'm joining this webinar from my home in the only clean room sitting on the floor so that we have a clean background behind me. But I'm just going to take a moment and let my colleagues introduce themselves and where they're at right now.
Hi, I'm Tahina, and I am currently in my office at Women's College because I wasn't sure that my daughter would interrupt my webinar from home. So that's why I'm here in the office.
Hi, I'm Carissa Chen, and I am in the resident lounge at Women's College Hospital, even though I'm no longer a resident. And I'm here because I just finished clinic and I needed somewhere quiet to record.
Oh, hi, I'm Karen Lee, and I'm just broadcasting from the very hot room up in my upstairs house.
I'm Jonah Schernbrucker, and I'm broadcasting from home.
I'm Karen Wong, and I'm broadcasting from my office at Women's College Hospital. Welcome.
Okay, great. So that's our group that will be doing this webinar today. So to start, we just had a few disclaimers for this presentation. Firstly, the content in this presentation is really intended for informational purposes and is not intended to substitute for professional medical advice, diagnosis, treatment, or care. So if you have questions about your specific situation, remember to always seek medical advice from your healthcare provider. And we also recognize that policies and practices vary by region and hospital, and we know that some of you may be joining from across the country. So although we've tried to present some general information in this presentation, we know that some of the information may not apply to all regions or hospitals. So for your personal care where you are currently at, it's important to ask your healthcare provider. We will be referring to pregnant individuals as people and or mother during this presentation, and we hope that this is inclusive of all individuals and families who may share the experience of pregnancy and birth. And lastly, the COVID-19 pandemic is rapidly evolving, as most of you know. So the information in this presentation is current as of May 20th, 2020. Now, the next thing that we want to cover is a couple of helpful terms that we will be referring to throughout this presentation, many of which you probably already know. The first one is COVID-19, which you've probably heard of. And for those of you who have been reading Dr. Google, and you know who you are, you'll notice that both COVID-19 and SARS-CoV-2 are mentioned in some of the literature out there. So I just wanted to discuss the distinction between the two. So COVID-19 is the infectious disease that is caused by SARS-CoV-2, the virus. And the virus is spread mainly through droplets, so through things like coughing and sneezing, but it can also be aerosolized. In other words, spread through the air, usually through certain medical procedures such as intubation. Now, in this presentation, we will be talking about the pregnancy journey, in other words, perinatal care, and how it may change during this pandemic. And perinatal care is typically divided into three categories. The first is prenatal care, which starts at conception and goes until delivery. Then there's intrapartum care, which is the delivery and birthing process itself. And then there's postnatal care, which encompasses the first 6 weeks after delivery. In Canada, you can receive perinatal care from family doctors, obstetricians, as well as midwives. And the last is personal protective equipment, PPE, mentioned on the news all the time. And this refers to medical grade equipment worn by healthcare workers to protect patients and themselves from infection. So during your labor and delivery process, you will see that your providers are taking the time to put on their appropriate PPE. And this can include masks, gloves, gowns, face shields, shoe covers, and hair covers, as demonstrated in the photo here.
So when we were making this presentation, we tried to structure it around the commonly asked questions that we receive from patients. And to start, a general question that is probably on everyone's mind is, what do we know about catching COVID-19 in pregnancy? And because COVID-19 is still a relatively new disease, our knowledge is evolving and there are many studies ongoing. And right now, the case numbers of pregnant women who've had COVID-19 in pregnancy are still low in respect to scientific data. What we do know, though, so far is that pregnant women do not seem to be more likely to catch COVID-19 than non-pregnant women, and that pregnant women who do catch COVID-19 seem to experience cold or flu-like symptoms, and some may develop mild or moderate pneumonia. But the odds of actually becoming very severely ill, such that you would, for example, need to be in an ICU, are still very low and are still about the same as for non-pregnant individuals. We also know that most babies who are born to moms infected with COVID-19 are born healthy. And in fact, the most commonly reported adverse effect that we're seeing is late preterm delivery, meaning delivery between about 34 to 37 weeks pregnancy. So another question we're asked is, can my baby catch COVID-19 from me while I'm pregnant? And this refers to vertical transmission. And also, like before, this is a question a lot of scientists are asking. There is ongoing research. So far, it seems that babies do not have vertical transmission. So almost all babies born from moms who've had COVID-19 are testing negative at birth. And in the few reported cases where babies have tested positive shortly after birth, it's still not clear if those babies caught COVID-19 while inside mom, or if it was shortly after in the delivery room, for example, from particles being in the environment. Now, COVID-19 has not been associated with birth defects. So for example, other viruses such as rubella, which are, COVID-19 is not. And again, more research does need to be done on this. So how do you protect yourself from COVID-19? And really the answer is it's the same way that other people who are not pregnant do. So you can use all the same precautions as the general population. What's really important is to wash your hands often using water and soap for at least 20 seconds. You can also use alcohol-based hand sanitizers. You should avoid touching your eyes, your nose, your mouth, especially with unwashed hands. You should avoid close contact with people who are sick or who are presumed COVID positive. And if you yourself are feeling unwell, you should be sure to cover your face if you're coughing or sneezing to prevent spread of anything to other people. You should also clean and disinfect high-touch surfaces in your home or in your workplace using alcohol-based cleaners. And you should stay home, of course, if you're sick and if you're not feeling well. So if you get symptoms of COVID-19 in pregnancy, what should you do? You should reach out to your healthcare provider to speak to them about next steps. We do recommend that you self-isolate, meaning trying to stay away from other members of your household if possible, as well as, of course, staying away from other people in the community. Depending on where you live, you may be eligible for testing, and so you should get in touch with your provider or your local public health unit to find out if you are eligible. And you also may need to delay your next appointment. And you should, again, speak to your provider about the option of virtual, either video or telephone appointments, as these may be an option for you.
So we recognize that while some of you joining us may be looking for information because you are pregnant, we also want to take the time to talk to those of you who may be joining us and are just thinking about whether or not this is a safe time for you to get pregnant. I just wanted to take this time to share 2 stories of women that I've spoken to in the last few weeks, just to highlight how family planning has always been a really personal decision. So the first woman I spoke to, she's 26. She got married in December, and she had spoken to me in January about whether or not she wanted to come off of her birth control pill in order to get pregnant. She had decided she was going to do that around March and then try to actively get pregnant around June. So she called me a few weeks ago to say she didn't think that maybe she should be doing that now. We talked about the reasons that she came to that decision, and part of it was that while she had fortunately been able to keep her job, her partner had lost his. So financially, they were in a little bit of a different situation. They had also just bought a house, so him losing his job was quite difficult for them. She also talked about how she was the first one in her group of friends that got married. None of them had children, so she didn't really feel the urgency that she thought she felt earlier about getting pregnant. Ultimately, she decided that financially it didn't seem like the right time, and she wanted to stay on her birth control pill and delay getting pregnant. The other woman I spoke to was a 38-year-old female who for the longest time wanted to be pregnant but hadn't found a partner. So she had made the decision that she was going to get pregnant with donor sperm. Unfortunately, all of her fertility plans were placed on hold because of COVID-19, and she called because she was quite anxious about how this was affecting her in terms of her decision to get pregnant. Thankfully, clinics are opening up now, so she was reassured that she should be able to get started and hopefully have the family that she's been planning for so long. So again, I just wanted to highlight that it is really a personal decision, that many things come into play when you think about having a family, and that, as we've already heard, that we know that pregnant women are not more likely to get sick, so it really shouldn't be the only factor when you think about having a family. So with regards to getting pregnant, what if you want to delay your pregnancy because you do think that it's not the right time for you to get pregnant? We do want to stress that emergency contraception, access to family planning and abortion services is considered an essential service. So you really should speak to your healthcare provider if you're looking to access these services. And what about if you are pregnant? We talked about how you're not more likely to get COVID-19, but how can you protect yourself, and is it safe for you to go back to work? Again, it really depends on your specific scenario. We know that healthcare workers and others in essential services are more likely to be in contact with people who have COVID-19, so they should definitely be wearing appropriate PPE when at work. They should practice routine precautions to avoid infections, and if possible, just to speak to your employer about avoiding unnecessary exposures. But again, it's important to talk to your healthcare provider about where you are in your stage in your pregnancy, what other health concerns you have, and whether or not it makes sense for you to go back to work.
Okay, so how might your prenatal care change during the COVID-19 pandemic? There are three main ways your care may change. Firstly, in order to reduce the number of people coming and going from clinics or from the hospital, you may be asked to attend your prenatal appointments alone or to limit the number of support people attending with you. And this may also be applied during midwifery home visits. Secondly, the timing or types of tests offered to you during your pregnancy may change. For example, the timing of your ultrasounds, or offering alternative tests for prenatal genetic screening or gestational diabetes screening. And thirdly, some of your prenatal visits may be appropriate to convert to a virtual visit, i.e. a phone or video consultation. However, there are some things that cannot be done virtually, like physical exams, blood work, ultrasounds, and vaccinations. And so we recommend that you have a discussion with your prenatal care provider regarding what's most appropriate for you. On this slide is an example of how the total number of visits during your pregnancy may be reorganized or condensed while still encompassing all the routine tests, ultrasounds, vaccines, and major milestones of pregnancy. You can see that there are some suggestions on the slide for some visits that may be appropriate to do virtually as well. However, depending on your individual situation, this may or may not be appropriate. So if you and your prenatal care provider decide to convert some of your pregnancy visits to a virtual visit, how should you prepare for this? It may be helpful for you to have some equipment at home, but I will preface this by saying that what we have listed is by no means absolutely mandatory for everyone to purchase. Some people may not feel comfortable checking some of these measurements at home, and that's fine. So during your visits, we check your blood pressure, your weight, your baby's heart rate, and the length of your uterus. If you and your prenatal care provider feel comfortable, you can track your blood pressure and weight at home. However, measuring your baby's heart rate with a fetal heart monitor or measuring your uterus with a measuring tape does take special skill and takes some degree of experience to do properly. So please check with your care provider first.
How can I prepare for my delivery? Now, more than ever, it is important to plan ahead. Talk to your prenatal provider about what to expect on the day baby arrives. Pack your hospital bag ahead of time. Lists of items to bring for yourself, your partner, and your newborn may be found on the internet and sometimes hospital websites. Bring a good supply of items and consider asking your friends and family for advice. If you have children and pets, make arrangements for their care ahead of time. Can I still take prenatal classes? The answer is an absolute yes. To maintain physical distancing, many prenatal classes have moved to an online platform. Furthermore, many cities and regions offer virtual resources through their public health departments. Virtual appointments can also be available to access dietitians, lactation consultants, and social workers. If I have COVID-19 or symptoms, do I have to have a C-section? No. Women with COVID-19 can have a vaginal delivery. You are usually in the hospital for 24 hours after a vaginal delivery and for 48 hours after a C-section. If you would like to be discharged earlier, speak to your provider. Who can be at my delivery? Every hospital region has a different policy. Due to limited supplies of PPE and staff, many hospitals allow a single support person, while some allow none. Your support person must not have COVID-19 or symptoms. Policies that limit support people are not made lightly. The rationale is that increased people in the hospital increase the likelihood of transmission of COVID, as asymptomatic people can also transmit the virus. If you are COVID positive, then your support person further increases the likelihood of transmission to others in the hospital and to your healthcare team. You may also be asked to wear a mask during labor, if tolerated, and to practice hand hygiene. If you have been diagnosed with COVID-19, most hospitals will not allow that support person, as we said. In some exceptional circumstances, every effort is made by the staff to support laboring mothers. If you are considering a home birth, please discuss with your midwife.
So what kind of pain management options will be available to me in labor? So for the most part, options for pain management have not changed during the COVID-19 pandemic. So methods in early labor, such as position change, showering, using a birthing ball, these are all available. In active labor, women still have access to epidurals and patient-controlled analgesia. There are a couple of exceptions, though, for patients who have been who have tested positive for COVID-19. Nitrous oxide, this is known as laughing gas in the dentist offices. This is used often during pushing in labor by the pregnant mom. This is not recommended as it may increase the amount of virus in the environment. Another technique of being immersed in water during labor offers good pain relief, but it's not recommended at this time for women who are COVID-19 positive or who are symptomatic. However, you can still shower as long as your support person has appropriate PPE. A few hospitals were recommending, this is actually from New York, this is certainly not the case in Canada, that they were recommending an epidural for all laboring women. So it's important to have a talk with your healthcare provider well in advance to sort of review your pain management options. Is delayed cord clamping still an option? Absolutely. Delayed cord clamping refers to when the umbilical cord is left attached to between mom and baby, and this can be delayed for up to 2 minutes after delivery. This is still very much an option. There is no evidence that it is harmful for the term baby, even in moms who are who have been diagnosed with COVID-19. If you are choosing, however, to do stem cell collection is still happening during the pandemic. You cannot request delayed cord clamping. It is important to speak to your provider about the specific risks and benefits of delayed cord clamping, again, well in advance of your labor. Can my baby stay with me after delivery? So it will depend on your COVID-19 status. For moms who are asymptomatic or COVID-19 negative, it is routine care. So what does routine care look like? Basically, rooming in with your baby and doing all the aspects of baby care, skin to skin, feeding your baby, changing your baby, spending your time with your baby in very close proximity. For moms who are COVID-19 positive or who are symptomatic, you have a couple of options. You can stay in the same room as your baby, so rooming in, or you can choose to be in separate rooms. These are from the Ontario recommendations. However, if you're choosing to stay in the same room with your baby, to decrease the risk of transmitting the COVID-19 virus to the baby, you will need to stay at least 2 meters away unless you're providing direct care to your newborn. Or you will also need to wear a mask. So this is in addition to once you are providing care to your baby, before touching your baby, the same recommendations that we have mentioned before: good hand washing, wearing a mask, cleaning your hands, both before and after providing baby care. If I have COVID-19, will my baby be tested? Absolutely. So for moms who are confirmed COVID-19 positive, the recommendation is that your baby will need to be tested within 24 hours after delivery, regardless of baby symptoms. In addition, you and your baby will be followed up closely and will be followed for up to 14 days after delivery. It is recommended that well babies and moms are discharged home early. And it is important, that's why, to have a good follow-up plan. So you can determine this with your midwife, your family physician, or even with your pediatrician in terms of who will be following you and your baby after delivery.
Okay, so towards the end of pregnancy, a very common topic of conversation is breastfeeding. And the decision to breastfeed or formula feed is a very personal one. But for those of you who have decided to breastfeed, a very common question that we get is it still safe to breastfeed if I have COVID-19 or I am having symptoms? And the answer is yes. This is supported by the Canadian Pediatric Society, the Public Health Agency of Canada, as well as the World Health Organization. Current evidence, although the evidence is evolving, shows that breast milk does not transmit the virus. Specifically, studies have been done testing breast milk to see if it contains SARS-CoV-2, and the results have been negative. In addition, studies done from the SARS epidemic many years ago actually showed that breastfeeding may have a protective effect. And what it showed was that breast milk of infected moms may actually carry the antibody and help to help the health of their newborns. The main concern with breastfeeding currently is that close contact while breastfeeding may increase the risk of transmission of SARS-CoV-2 through droplets. So for moms who choose to breastfeed, there's a couple of precautions that we recommend to decrease the risk of that transmission. So before breastfeeding, it's important to put on a mask, clean your hands, cleanse your chest with soap and water, as well as consider using a nursing cover if a mask is not available or in addition. And pumping as well is safe if you have COVID-19 or have symptoms using similar precautions. Okay, so this next question, how do I prepare to bring my baby home? I often get this question in clinic from parents with pure fear in their eyes because they just really feel panicked about this. So really, and I get it because preparing to bring a baby home is daunting even in the best of times. So trying to bring a newborn home in the middle of a pandemic is all the more challenging. But my main advice is to plan ahead. And after planning ahead, the next advice that I have is please don't panic. And after you take a deep breath and you don't panic, remember that even the best laid plans often go awry. So you're just going to do the best that you can. When you're starting this process of planning, I usually recommend to the parents that I see to think of the big categories. The first one is rest. So when you get home from the hospital, you are going to be exhausted, and it is okay to make sleep, rest, and taking care of yourself a priority. So think now about ways that you're going to carve out a few hours a day just for yourself to either take a nap or do something else just for yourself. You might also want to consider getting a postpartum survival kit. And if you Google that online, you'll see many lists of what you'll need for that kit. And another thing that's really important is just to have an open conversation about parenting responsibilities with the support people in your life ahead of time. Who are those support people going to be? Identify them. Talk about how you're going to deal with multitasking, and just open a line of communication. The next big category is eating. So plan to have healthy pre-made foods and snacks available. And then also think about contingency plans. Let's say you've planned a meal, but you need something else, or you planned a meal, but it has gone rotten. Think about other ways that you are going to get food and how you're going to do that safely. The next is baby care. So a lot of people have thought that they can't have that baby shower that they always wanted. Yes, you can. You can have it virtually. Have that baby shower and stock up on those much needed items that you need to take care of your baby. And also remember to find a healthcare provider for your baby ahead of time. During this pandemic, some clinics may be stocked with appropriate PPE while others may be struggling a bit more. So make sure that you identify your care provider and who's going to follow up with your baby afterwards. And the last one is to stock up. During this time, more than ever, you want to avoid leaving your house unnecessarily. So think about what you need for your baby, what you need for your partner, what you need for the other household members. And multiple lists are available. You can sometimes find them on your hospital website, you can find them through the city, or you can just find them through Google. The next is, if I have COVID-19 or symptoms, how do I care for my baby at home? And it's true, once you bring your baby home, you are going to begin a new journey of pregnancy. And we are going to ask if you have COVID-19 or symptoms to take certain precautions. Now, some of these precautions may sound like an impossible task, but again, you're just going to do your best. So the precautions that we recommend are for the first 2 weeks or until your symptoms improve, that before you touch your baby to wear a mask, clean your hands, and also cleanse your chest with soap and water before breastfeeding, as we mentioned before. But in addition, wipe any commonly used surfaces with disinfectant, and maybe even take a look at your home and plan for a dirty area of your home where you can receive and open packages, groceries, or food if you need to. And when you're not actively caring for your baby, when your baby is taking a nap or sitting comfortably or lying comfortably, have them rest 2 meters away from you. In other words, practice physical distancing when you can. And the last very controversial question is, can visitors come to see my baby? All of you are going to have your own personal situation. You're going to have visitors wanting to break down your door to come to meet you and your baby afterwards. But unfortunately, this is currently not recommended. We know that the best way to avoid getting COVID-19 is to maintain physical distancing. And so having visitors to your home is not currently recommended. But remember that this is not the same as social distancing. So we recommend that you find other ways to connect with your loved ones to show off your newborn. So consider hosting a video conference, for example, through Zoom or through another video conference platform. Share a daily collage of your baby's special moments or silly faces. Record your baby's first sounds or movements. 1, your family and friends will appreciate this, and 2, you'll have those memories stored for the future.
So now you've done all this planning, you've brought the baby home, and next often is, when does my baby need to be seen again once you've been discharged? So the typical time frame for which to be seen again by a healthcare provider is within 2 to 5 days. And this is a really important check-in to make sure that baby is gaining weight, that breastfeeding, pumping, or formula feeding is going appropriately. So it really is important to have a plan of who's going to follow up with your newborn once you've been discharged, and to also call ahead, because if you are someone who's been identified as COVID-19 positive or under investigation, we want to make sure that your healthcare provider is prepared for your visit and has the appropriate PPE on hand. So on top of all the things that you'll need to look out for with your baby, one of the things that parents are often asking now are, what are the symptoms of COVID-19? How can I find out if my newborn has it? So it's really important to talk to your healthcare provider firstly if you do have concerns. I would also suggest you talk to them about what's the best way to check your newborn's temperature. So how to purchase a thermometer, which type. Other symptoms you may need to look for are cough, vomiting, diarrhea, poor feeding, any signs that your baby's having difficulty breathing. But really specifically, if you have any of these concerns, it is a very strongly recommended that you call your healthcare provider for further advice.
Okay, so on these next couple slides, we provided some resources for those of you who are interested. This first slide here has some resources from the Government of Canada, which are a good place to start. The bottom line is that if you are worried about your physical or mental health, your baby's health, or your family's health during this time, please, please, please reach out to your prenatal care provider and or family physician. We know that these are trying times for everyone, and in your particular region, city, or even community, there may be more specific resources for you available. For those of you living in Toronto, these are some of our favorite resources that we've used a ton, and we highly recommend them.
So thanks so much for joining us for this webinar. We hope that we were able to answer some of the most common questions that you might have had, and certainly that we're hearing in clinic. We've referenced some of the resources that we looked at in creating this presentation, and we've and we will have this presentation available online to you afterwards. But again, thank you so much, and we hope to answer any additional questions you have during the question and answer period.